And glad to have you here. Please, if you're not hungry, we have some fresh empanadas there. Some you can hungry. So,
It's good you're not hungry.
Stand for the pledge. Before we start.
That's what I said.
Okay, where do we go? Here. All right.
Is he copied?
Okay, the main here is,
There's this guy.
there we go, we're leaving.
Yeah.
Look at me. Yes, sir.
Here you go, sir, right? Yes, sir. You want this one, sir? No. What up, bro?
Reg's not here. So you're here with all the big.
The game.
So I'm the regional director for I work with Clarice. Yeah. What's your name?
Alright.
So,
You guys need it on recording?
Oh, yes.
Good afternoon.
And even
Good
better.
afternoon. Today is our This is the regular meeting schedule for the Veteran Advisory Board, which usually stands for the pledge of allegiance and the invocation.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
That's the Cheney's family. That's all the families that are not getting back. That's those that may or may not be receiving their paychecks. That's the people in the nursing home, hospitals. That's our wounded warriors. That's everybody under the sun. Precious name we pray.
Amen.
Right, go to public comment. Do you have public comments yet?
Yes. Hello, everyone. I am Roberto Garza, Regional District Director for Congressman Tony Gonzalez. We want to give a quick update on a few things. One, please continue to share with your constituency and all your veterans in the community that our office is open and we are in San Elizario, Texas, 1501 Main Street. And I'm usually only by appointment only, right? Because I have to be out here and I'm a one-person office. So please share that. And why is that important? Well, it's important because we assist with federal agencies. And what does that mean? Well, everyone here knows a veteran who's going through casework with the VA or casework with Social Security or any federal administration, any federal organization. We can help. They reach out to me. I do a case on behalf of the congressman, and we can get those cases rolling again. A lot of times it's communication or something got lost here or there, but we can get the ball rolling again. And it's very important because we don't want these veterans to miss out on benefits that they've earned and deserve, right? So please ensure you're sharing my information with them. Everybody's got my email, everybody's got my number. Please continue to share it. Number two, I want to introduce the fact that last Thursday, we introduced an act that'll be very important to the region here in El Paso. We introduced the Rural Veterans Dental Care Act, which will establish a pilot program to furnish dental care to veterans residing in rural and highly rural areas, which a lot of El Paso County is. It authorizes the mobile delivery methods, including dental vans with full diagnostic and treatment equipment, modular or containerized mobile dental clinics at VA community-based outpatient clinics or rural health fairs, and prioritizes locations more than 75 miles away from a dental clinic. So this is huge for our region. Hopefully we can get it passed through, but we introduced it last week. And also, you know that the Military Construction and Veteran Affairs Appropriations Act also got passed last week. And that's important because it brings $167.7 billion to deliver healthcare. It brings $263 billion in mandatory funding for veteran benefits. And one that's critical here, there's two more that are important in this act, is 1.4 million for 1.4 billion for healthcare services dedicated to women veterans. And the other one is we know that our service members on Fort Bliss don't always live in the best housing. Even though it's privatized, it's not always the best. So $30 million is used to strengthen the oversight of that privatization oversight, right? So to give someone, to be able to provide someone who's going to be able to keep them accountable, right? So it's very important. So those are just the key stuff that I wanted to provide at this time. I don't know if I can answer questions.
Yeah, not.
Yeah.
Thank you
Yeah.
so much.
I'll get you later. I'll get you later.
Anyone else for public comment? Go to item number 5. Discuss and approve the meeting minutes for the Veteran Advisory Board meeting on September 19th, 2025. Second. All in favor?
Aye.
Anyone opposed? Motion carries. Discuss and approve the meeting minutes for the Veteran Advisory Board for October 17th, 2025. Move to approve. All in favor? Aye. Anyone opposed? Motion carries. Go to item 2, receive a presentation from Endeavors of Paso Health and Wellness Center on overview and services provided.
Excellent. Thank you so much. I can get started as you look for those, Tony. So good afternoon, everybody. For those of you that attended last week's grand opening for the Endeavors Health and Wellness Center, I really appreciate everybody. I'll take just a quick minute, give you some background. So in why it was such a milestone for our El Paso community, for our veterans, our military connected community, and our local first responders as well. So for those of you that were in the veteran space in 2019, if you recall, we approached the county to ask to fund and help us fund the El Paso Veteran Needs Assessment. So the county commissioners approved that motion, and they contributed to that needs assessment that was conducted in 2019. So it's a collaborative effort between the El Paso County, the Chamber, the City of El Paso, and Endeavors. We brought in UT to come and do a comprehensive needs assessment to really find the gaps of services that continue to exist in our community when it comes to the veteran community. Out of that needs assessment, we found some gaps that still existed, knowing that there's a lot of wonderful organizations that are helping veterans and their families with an array of services. But what it did to us, what it did for the county, what it did for the chamber, what it did for the city, it helped us really structure how we collaborated and unified efforts to continue to serve our military and veteran population. It was a phenomenon, right? Some of us are even talking that we might, coming soon, we might have to do another needs assessment because things have changed in the last couple of years on how we approach to serve the veteran community. So because of that information, the City of El Paso received a phenomenal return of investment. That needs assessment cost us about $25,000 to complete. The return of investment that we just received was amazing. A state-of-the-art, second of its kind in the country, facility that's here in our community to serve our military, active duty families, our veteran community and their families, and our local first responders. Here in El Paso, about 30-some% of local first responders, that includes the sheriff's department, the police department, the fire department, EMS, and 911 dispatchers, are veterans that are continuing to serve in our community. So what we're able to do is consolidate a lot of efforts in collaboration with many national partners, state level partners, and local partners to come and bring all these services under one roof to serve our veterans and their families. And as you see here, this 10 acres this is about a 42,000 square foot facility where our veterans, our military, and our first responders are going to receive phenomenal mental health care and wellness programs. A lot of these services will be at no cost to the veteran and their families. We have a great partnership with the El Paso VA. They continue to be a great referral partner, especially when the veteran's being cared by the VA. We can care for the family at the same time, right? So it's a perfect combination with the veterans getting phenomenal services in our local VA, but then the spouse, the boyfriend, the girlfriend, the partner, the children are being served by Endeavors. What a great collaboration, right? What a great partnership. In addition to that, the Cohen Military Family Clinic moved in there. So for the last 8 years, the Cohen Military Family Clinic has been primarily serving post 9/11 veterans and their families with short-term evidence-based mental health care, where we will see children ages 5 and above. We do family therapy, marriage therapy, individual counseling, and it's the same thing. While the VA is serving the veteran, we can be taking care of the family. So it's a great partnership. One of the things that I next slide, please. One of the things that I want to really hone in is, next slide, please, is really what our model is, right? This is the Endeavors Wellness model that will be implemented within the Health and Wellness Center. It's 5 pillars that we focus on to serve the veteran, the military community, and the first responder community. It starts with spirituality. We have a wonderful organization called the Warrior's Journey that's headquartered in Missouri that's expanding their footprint in El Paso. They were never thinking about coming to El Paso, but because of the collaboration that we have as a community, as a veteran community, they decided to join our efforts. So they're going to be embedding their services where a lot of them are retired chaplains from the military, but they're bringing the spiritual component of healing. We have great licensed counselors, right, that do the evidence-based. But what Warrior's Journey is, they're going to be talking to the heart. So we're going to have counselors talking to the veterans in the military community and first responders, healing the mind. Warrior's Journey is going to be healing the spirit. What a great combination, right? So it's phenomenal. And then we have the mind and body, the financial strength, the purpose and growth, and the connection. For example, GCU joined our efforts. They embedded a financial counselor inside the Health and Wellness Center, and they're going to be providing free financial literacy classes. Right? If a veteran wants to learn how to buy a home, how to transition from one job to the other, how to save for college, our first responders, the same thing. This is a great partnership. And then we have great partners like Columbia Southern University that'll be providing a lot of the education things too for our military community, for our first responder community, for our veteran community. And then if you all remember, the Wounded Warrior Project has never had a permanent presence in El Paso. Next slide, please. Right? They don't. So traditionally what the Wounded Warrior Project would do is, next slide, please. They would send their San Antonio team to El Paso once a quarter. And then they would host events here in El Paso. So because of this Health and Wellness Center, the Wounded Warrior Project decided to open up a permanent presence in El Paso. That's a national level veteran service organization that now has a permanent presence in El Paso. So they hired someone permanently, and they'll be operating and working within the Health and Wellness Center. That's phenomenal for El Paso. The same thing with the Elizabeth Doe Foundation, right? We have a phenomenal fellow, Ms. Linda Maiz here, but from the headquarters level, we've been talking to Mr. Steve Schwab, who's the CEO, and Ms. Elizabeth Field, who's our COO, and we convinced them to partner with us at national level perspectives. And one of the things that we're gonna start doing in January is we're going to be serving caregivers in El Paso in this Health and Wellness Center with free services. So caregivers of veterans will receive free mental health care, free chiropractor services, free massage therapy, TMS services, and all the life skills within that Health and Wellness Center at no cost to the caregivers of veterans. Isn't that amazing? The partnership that we were able to build with the Elizabeth Doe Foundation, from national organization to national organization, to serve our caregivers here in El Paso that are still caring for veterans. And that's going to be great. And then we're going to be talking to the El Paso VA about this caregiver program, because we want the El Paso VA to come along with us to be able to target caregivers and say, there's a place for you to come and get a massage, chiropractor services. Because as a veteran myself, I take advantage of the whole health program at the VA. So I get all these services. But then my wife's my caregiver. She goes, well, I need some of that too. So I went home and I say, babe, I got you some good services. So guess what? You're going to be able to get some massage therapy, some chiropractor services, right? So we're going to be able to do that here in El Paso, because these national level organizations are believing in what we do as a community when we're serving veterans. And here's a laundry list of current partners that are already inside the Health and Wellness Center. And we're just thrilled that now it's a reality. We've been working on this project for the last 4 years. Well, really, it goes back to the needs assessment, right? But really getting a concept of, let's build a Health and Wellness Center. And then we're having conversations with the El Paso County VSO, with Ms. Tony and her team, of the possibility of also collaborating with us inside the Health and Wellness Center, right? And also with Mr. Soto's team, of the possibility of the VA healthcare system coming alongside of us and doing some things inside the Health and Wellness Center. But there's just the possibilities there. So what all I'm saying is, if you all ever have time, if you didn't get to see it last week, come and tour it and visit the facility. That's your home. The Health and Wellness Center is for us.
and for our families. So come and join us. And if you ever want to host a meeting there, a conference, a summit, we have public space and a lot of good parking too. So know that this health and wellness center was built for us. It was built for our family. It was built for first responders and their families. And I'm proud to say it's the second of its kind in the country. We built the first one in San Antonio, but it's smaller. The one here in El Paso is a lot bigger and with a lot more parking. So take advantage of it and use it because that is a place for healing. That is a place to save lives, marriages, and families. So I'll pause there, but I do want to do one thing. I want to present our Endeavors coin to Tony because Tony has been so instrumental as the leader, right, for the El Paso County VSOs to be able to bring resources together and to help Endeavors, right, and to bring partners together now at the county level and at the local level. And Tony, last week couldn't have been possible because I know you've been joining me for a lot of tours with county commissioners. We have one more tomorrow too. But the leader that you are in what you do for the veteran community, Mr. Chip Fulgham, our CEO, wanted to make sure that I give this to you. But it's my honor to present at least our coin to you. But I'll pause there for any questions. And finally, we opened and we're open for business.
Questions? Do they have questions for Ben and Endeavors?
I just want to say thank you, because as an old Army guy, old Sergeant Major, as old Chief of Police, as old County Commissioner for Reserve, our big concern was how do we keep soldiers, policemen, or firefighters, and all the supports, how do we keep them focused on the mission? Because one thing that takes their eye off the mission is family. They look back, what makes them look back is what you're addressing. Now they don't have to look back anymore. They know their families are taken care of. There's opportunities for that. There's opportunities they're getting taken care of. And I won't say it's a one-stop shop, but it covers a lot of bases. And it keeps our folks out there who respond every day in harm's way. Like I said, you tell them, hey, these guys stand between you and harm's way. Keeps them focused on what they need to focus on because taking care of the family. That's one thing we adopted when we started the FAD is veterans and their families.
Mm-hmm.
You know, it's hard to take care of the family sometimes. It's hard to get those fundings or the care the need that's needed for the families. You know, but on the way.
Thank you. God's good.
Before we read in the next item, Mr. Soto, do you want us to front load you? Do you have somewhere to be? 'Cause I have two items in front of you.
No.
Okay, I just want to make sure that you're good to go. We appreciate that you're here and I'll make sure that it's ready.
What's your address?
12135 Pebble Hills,
You can't miss it.
corner of Pebble Hills and Joe Battle.
You can. You really can.
You really can't miss
Right next
it.
to the biggest Circle K in town.
Yeah.
Yeah.
Which I'm there almost every day. Real estate, brother.
And you
No, that's it. I'm done. No, thank you. Appreciate you.
Thank you. Okay, let's go to item D. Receive a presentation from Jaime Barcelo on the Medal of Honor recipients from El Paso. Pleasure.
Well, thank you, everybody, for this little spot.
Yes, sir. Right here.
Thank you. I don't think I made enough copies, Ms. Hunt, but, yeah, and as I learned a moment ago, and I learned before, this list is incomplete. My name is Jaime Barcelo, retired lieutenant colonel. I joined the Army in 1973 out of high school, went to Fort Bliss for the 3rd Armored Cavalry Regiment, and then to Germany, the 11th Armored Cavalry Regiment, came back home, took my GI Bill to UTEP and got my commission in the Army Reserves and did another 27 years there. Let me tell you a little story about how I got to be here today. About 10, 11 years ago, I went into the local McDonald's to meet with some friends, and they're all over there having a very intense conversation, and being who I am, I just kind of went in there. And they were talking about moving a monument to the men of Company E. I don't know if any of you are familiar with that story, but there's a monument on Delta Street across from what I politely call the shit park, the sewage treatment plant. And the veterans that were there were asking if they could move, if we could help them move that monument downtown. So we consulted an engineer and he said, yeah, we can move it. It's cheaper to replicate it. So there we go to replicate, and that effort turned into what is now across from the ballpark right there in front of the History Museum. And if you haven't seen it, you got to go. It's the largest monument downtown to the men of Company E. I won't get into that story unless you want me to later. But I became a researcher for that project. And during that research is when I started coming across some of these stories. And so here's the ask for you guys, those of you on the Veterans Advisory Board, is to go back to the commissioner and the judge that appointed you and said, hey, we got to do something. So that monument to the men of Company E, the unit was headquartered here in El Paso. Many of those soldiers assigned to that unit was Texas National Guard were from El Paso, most of them from the south side right here. And that kind of got me started on the local war hero kind of thing. And as I started doing research for that project, I started learning about men who have lived in El Paso, who have called El Paso home and earned the Medal of Honor, and we don't know them. And so I've got 8 here. You're going to help me add another 7, you said? 5 more, 13, who have lived in El Paso, and we don't know who they are. And that's a shame. Shame on us for not telling the story. Once I got into the discussion about the men of Company E, we had to tell that story. And as I was doing some research, whoa, look, there's Uncle Louie. I found his picture on the internet. Uncle Louie. And I remember when Uncle Louie told me that story, he was drunk, and I really didn't want to have that conversation because he was drunk. Again, 40 years later, I'm looking, I go, he wasn't bullshitting. It's true. It's true. And we need to tell the story. We need to tell these stories. And so I've met with the county judge. In fact, I met with a county judge on April 30th and the Mayor Johnson in the same meeting right there in their office, and had a long conversation. We met for about an hour, and they both shake their head. Let's do something. But what do we do? And so my plan at that point was right there where the Men of Company E monument is, let's just continue on Cleveland Square. Cleveland Square, by the way, used to be the military cemetery until they moved all the remains to Fort Bliss National Cemetery where they're at today. And the land was deeded to El Paso by the Grover Cleveland administration. That's why it's called Cleveland Square. So I said, well, okay, we can do something there. And as I went by with that same engineer, and long ago they said we can move the monument, it's cheaper to replicate. And we start, our local architect, we start walking, looking around. There's not enough space there. I don't know if any of you have been to the park right here, Calendar Park. There's a small marker for Vietnam. I remember as a boy, that was the bus stop when we'd catch the bus from Central El Paso to come downtown, or the streetcar, either one. And that was the stop. And I remember seeing the monument to World War I KIAs. Well, there's one there, and there's a monument which bothers me. It's got World War II and Korean War veterans, KIAs, in the same monument. They said they should be separate. There's a smaller marker for Mexican nationals who died in combat, Mexican nationals, but they died in combat in defense of our country. The park itself is not very big, not very well maintained, and all those markers are relatively small with the exception of the one for World War I. It was built by the mothers of the World War I veterans, which today we call them Gold Star families. At least that's what the west side of the monument says. If you haven't been there, please go look. but we need to do something. So I'm looking at where we can do something. I had a conversation with, I don't know if you know Miss Tracy Yellen. She's the CEO for the Paso del Norte Community Foundation. And had a conversation with Mayor Johnson. And I just kind of said, well, you know, we could do it at the Plaza Deck. Are you familiar with the Plaza Deck?
Yes.
Yeah. And they thought that was a wonderful idea. I had a conversation then, more detailed conversation with Tracy Yellen after that. And she says, Jaime, that's great. Well, we don't know if that's going to happen yet. So where do we do this? And to me, everybody says, let's put it Flags Across America. I don't want to offend anybody. But nobody goes to Flags Across America until there's an event. I've been there many times for the events. I went over there to show my brother-in-law when he was visiting. There's nobody there. I went there to take pictures of all the things. There's nobody there unless there's a veterans event. You can't see from Diana what's there. You can't see from 54 what's there. We need to put it, if we want to tell a story, where it's visible. And to me, that's downtown. The other possible location is what they call the Art Walk. The Art Walk is right between the Civic Center and the ballpark. And it starts there on El Paso Street, Santa Fe Street, and it goes to the overpass down to the Union District. Okay, been there. There's no traffic. When there's events at the Civic Center, nobody goes that way. They'll go down into the parking garage, or they go downtown. There's no traffic. Where do we put it? The judge suggested, county judge, somebody else suggested, hey, let's put it down there in that big open space. You can't go unless you walk in through security, you know, and take the elevator down and then go visit that open space. It's not visible. So where do we put it? And that Plaza Deck seems to be a good spot. So what do we do? and the intent is to put together a group of local citizens that says, what do we do to honor these guys? And there's 13. I'll update my list. There's 13, and here's just 8 of them. And I from my personal experience with folks, they don't read a lot, so 2 pages is a lot. So it's limited to 2 pages. I'll add the others, and I guess there's 3 pages now. But people won't read too much, so it's got to be brief. So this is brief. I've got a longer document, still working on it, because there's fantastic stories. The very first one there, Silvestre Herrera, was born in Camargo, and his parents died when he was an infant during the Spanish flu pandemic. And his uncle brought him to El Paso and raised him as his own. And, you know, he's growing up, he's married, raising a family. He gets a draft notice for World War II. And his uncle tells him, you're not my son, and you're not an American citizen, and you don't have to go. And he says, well, nobody's going to die in my place. I'm going to go. So he goes. And short story, he lost both legs in France to landmines, and took out some enemy machine gun nests and so forth, allowed his unit to continue the advance. He earned the Medal of Honor. He passed away in Arizona. He's buried there. But fantastic story to me. We need to tell the story. And so telling you, if you don't know, is part of that telling the story. Telling your commissioners is part of that story. I know Commissioner Butler knows, and the county judge knows, and Commissioner Holguin knows. The others, I don't know if they know. But we need to tell the story. Now, we were asking about funding. And then I said, oh yeah, no, there's business partners. Because when it comes time, how much? I don't know. It depends on how much you want to do and when you do it. The longer you wait, the more it costs. The more you want to do, the more it costs. And so Tracy Yellen says, well, I guess we have to raise more money. So that was what I wanted to share with you. And here's another one if you want it. speak with your commissioner, tell them we got to get something done. Let's spread the story, and visiting them back with Samaniego and Johnson to say, let's put a committee together, a commission, a council, whatever you want to call it, so we can say what we want to do. They all want, when I had the conversation with Oscar Leeser, he only asked me one question. He says, how much? And I said, Mayor, I'm going to put you down as you did not say no. But he's interested. A lot of folks are interested. It's a matter of let's push folks to get some action done. Are there any questions? Yes, ma'am.
You may want to add, just from my behalf, I live in the Northeast, and we're getting the amphitheater there, and that's going to be a lot of traffic. I also live in the Northeast, and I'm the chaplain for Flags Across America, and there is good traffic. We're also getting a museum there. That's going to bring more traffic. So those two places, Veterans Park in the Northeast, would be absolutely a great place. We have one lonely soldier out there. I'm talking.
I've been to that. I've been to the one statue out there in Veterans Park.
Right. He needs some help. He needs somebody out there with him.
Yeah.
He need a battle buddy too. So yeah, that would be a nice place with the amphitheater and out there. So that would be.
Well, I appreciate that.
Okay.
I appreciate that. Any questions? Yes, sir.
Have you approached the private sector, potential funding sources?
We have to have a plan.
Yeah.
We have to have a plan before we ask someone. And the answer to your question, though, is that would be Tracy Yellow's job. She knows where the deep pockets are. So do I, but she knows where the deep pockets are. Are there any other questions or comments?
Any other questions for Mr. Maxwell? Thank you so much for giving us your time and
I
educating.
appreciate it. And if there's nothing else, you all have a good afternoon.
We are safe.
Thank you. Just go ahead and go to item E. Do your presentation from Columbia Southern University, Administrative and Veterans Education Office.
Good afternoon, everyone. My name is David Sear. I'm new to the veteran community. I just retired from the Army in July.
Congratulations.
Yeah, so got my DV plates installed and got free parking downtown finally. So I work for Columbia Southern University. I am the Army Strategic Advisor. They hired me on to try to find ways to improve our efforts with the Army community. Mainly focused on the active duty community and trying to build partnerships and pathways to become partners on base, provide learning partnerships and things like that for active duty soldiers. But we have also an entire veteran outreach space that we engage in as well. Next slide, please. Brief agenda. That's what I'm going to cover. Probably won't talk about the learning partnership in the interest of time, but I do want to get into a brief overview about Columbia Southern University and then talk about some of our specific veteran initiatives that we engage in at the university. Next slide, please. Right, so Columbia Southern University, it's based out of Orange Beach, Alabama. That's where the headquarters is at, and that's where most of the staff work. I live and reside in El Paso. I'm from El Paso, and I'm not going anywhere that let me work from home. My claim to fame is the first time I've put on shoes in a while. You saw me with shoes on last week. Typically, I'm in flip-flops, though, when I'm working from home. So it's a good thing, right? So yeah, we're a 100% online university. We are fully accredited through the Southern Association of Colleges and Schools Commission on Colleges Accreditation. We were talking about the difference between regional and national accreditation earlier. That's kind of a thing of the past now, and this is our major accreditation body. Our business programs are also accredited through a separate, more rigorous business accreditation program. We offer about 141 total different degree programs, ranging from business, finance, OSHA. We started as an OSHA organization back in 1993. So we're one of the industry leaders in that space as well. At all levels of education, from associates up through doctorate. And then we also offer a lot of stackable certifications that go along with those as well. For instance, if you're pursuing a master's degree in business management, you can get your project management certification along with that. I'm currently enrolled in my doctorate program with Columbia Southern for a doctorate of education, and I'm doing the stackable for my education specialist and curriculum and instruction at the same time. They're just courses that you're taking anyway. You pay the additional registration fee for something like that, and then it comes your way. Our affordable tuition rates, really, we can't be beaten in that space, right? $278 for everything that's undergraduate per credit hour. comes out to right around $750 to $800 per class per class. It goes up to about $359 for master's degrees and just over $500 for a doctorate program. So if you're familiar with price, and that really is affordable when we talk about affordable. For our veterans specifically, we discount that down 10% for them, for the veteran, for their family members, their children, and even their grandchildren. They're able to get about a 10% discount on tuition. That doesn't seem like much at first, but over the course of an associate's degree, that's an extra class that they can apply for any funding that they're pulling in from the outside. For a bachelor's program, there'd be 2 additional classes that they can take over the life of that just based off of the 10% tuition. And then we also offer our course materials and books at no cost to our students. So we eat that cost. That's whether they need a hardback textbook, it gets mailed to them with the return label, they just mail it back. Or if it's an online e-textbook or a lab resource, that's available for them in the learning management system already. They don't have to come out of pocket for that. So again, that's, over the course of an associate's or a bachelor's degree, that can be anywhere from $2,000 to $4,000 worth of savings for them not having to pay for books. And then I don't know if this is different. I don't know, you guys, Mike Barnes is CSU alum. I didn't know that before, and I learned that today.
Moving at that.
Yeah.
Long time ago.
Yeah.
Good course. Good
right.
Great school.
But our life-based approach to learning is probably a little bit different than what you experienced. And really, that's just 3 different things coming together to work for our students. First one is our scheduling. We've got 11 different start times throughout the year for our courses and no minimum course enrollment, right? So we have a course that your next course starts within the next month period. Right? Every month, except for the month of June, we have a course starting. Traditional online universities that do 8-week semesters like us, they have 2 semesters in the fall, 2 in the spring, and then 1 over the summer. We don't do that. We have, depending on when you start your degree program, your next course can start within the month. Part of the life-based also is our auto enrollment option. Lots of times adult learners might forget to register for their next class and then it's too late. And if they have the funding system coming in, they can set up for auto enrollment, and then that gets them, they'll get a notification that they're enrolled in the next course. And they need to do the opposite. If they don't want to take it, they need to speak up and say, no, I'm not ready to take that. And the other thing is our scaffolding. The way that we deliver our courses is a little bit different than some other schools too. I've got 2 master's degrees, and I did those both online, and they were both in systems where I had to wait for Monday to roll around for that week's worth of assignments to open up to me and be available to me. At Columbia Southern University, in our first week, you engage in a discussion board. Once you've completed your requirements for that discussion board, all the way up through the end of week 5 opens up to you. So if you're motivated and you have time to work ahead, you can. You're not waiting for deadlines or suspenses to be met. Or
if you're a procrastinator.
Exactly, you can still do that. There's still due dates, right?
Yeah.
And then in week 6, it starts over again. You have another discussion board, and it opens up 7 and 8 to you, right? So if they're looking to work ahead, they can. I am finally taking classes at Columbia Southern in my doctorate program, and like I was telling you at the Endeavor's grand opening, I wish I knew about Columbia Southern before I engaged in my previous college, because I like the way these classes are running a lot better. They truly are different. I just want to pause if there's any questions about this before I go on to specifically veteran benefits. Next slide, please. So, first I want to talk about our outreach teams. We have military, veteran, and spouse and family outreach teams specifically dedicated just to reaching out to those communities. I fall technically under the military outreach team, but we have 3 dedicated veteran outreach representatives. So what we do as outreach representatives, it's similar to what maybe an academic advisor might do, but we don't take the place of the academic advisor. We're somebody that is a veteran that the best that we can served in the same branch of service as the student, and we can speak the same language when they start talking about needing extensions because of life requirements, mission requirements, or things like that. We can speak that same language, and when they're having difficulty communicating with their instructors, we can, I call it coming off the top rope. Right? We can come off the top rope and mediate on their behalf and help them get the extensions that they need, or get, mission takes place and they need to withdraw from a course. We can step in and get that course forgiven instead of them having to pay back their tuition reimbursement or tuition assistance programs and things like that. And we stay with them for the life of their adventure at Columbia Southern. We're always there for them. Sometimes in the background, not really doing much, but every now and then we'll reach back out, see how they're doing, right? Pretty unique compared to other universities I've been to. Now, I already mentioned the 10% discount, but I want to talk about the VA Flex Plan. This is a way for our veterans to get started in school before funds start. So specifically speaking for chapters 30, 35, and 1606, which is the reserve Montgomery GI Bill. So for the actual Montgomery GI Bill, the dependent education assistance, chapter 35, and then for the Montgomery GI Bill selective reserve, we allow them for $99 down to start taking their courses. And then once those monies come in, they're allowed to do that through throughout 2 academic terms or 4 months worth of school. And then once they engage in their 3rd month, they pay off that debt. Now, we don't do that specifically for chapter 33, the post 9/11 GI Bill, or the VRE. And that's because, well, with chapter 33, that money's paid directly to the school. And if they've already been making payments on that debt, they don't get reimbursed for that from the post 9/11 GI Bill. And then with VRE, they found that lots of times that money doesn't come. They go through the claims process and they may get denied that. We don't want them to enter into a large debt with us based off of money that they thought was going to be coming in, and then they don't get it. Right? But everything, the other 3 chapters of money, they're able to start school and then with a $99 down payment. Next thing I wanted to kind of talk about is our exclusive veteran scholarships. One I wanted to highlight in particular is our Forever a Hero scholarship, and that's open to veterans from any branch of the service for them to apply for, and that's a full scholarship for up to 60 credit hours or their next credential. So if they have an associate's, it's up to their bachelor's. If they already have a master's, then they can use it and apply it towards their doctorate program. We give that away every year. I also wanted to highlight our heroes behind the heroes, because Ben was talking a lot about the things that they're doing with the first responder community. Columbia Southern University gives out 8 scholarships per year for spouses of veterans and first responders. So we have 4 award cycles where we give 1 to a spouse of a veteran or service member, and 1 to the spouse of a first responder. And it's the same scholarship. It's a full ride up to 60 credit hours or their next credential. Next thing I want to highlight is our career services. What we found is a lot of students have elapsed and come out of their ability to go back and reach to transition assistance with from their branch of service. So our career service really mirrors exactly what the transition assistance program is doing. We're helping them do labor market research. We're helping them ace the interview and prepare the resume and make sure that they're applying for jobs that are relevant to their community and they're not going out and underselling themselves. And this is open to all students, but specifically speaking, that department is led by a veteran, and he specializes in veteran transition assistance. He specializes in translating that resume. Nobody cares that I'm a retired sergeant major now. No, I learned that really fast. Like, that doesn't matter anymore. Nobody cares. And a lot of people don't even know what that means. Like, they don't care, right? Like, I gotta call myself a manager now, or previous me, right? So nobody, but he helps them figure those things out, especially for those that got out, came back to school. Maybe they spent 2-3 years finishing their degree, and they're just not eligible to go back to Fort Bliss or wherever they came from to go and use that transition assistance services anymore because of the 18 months that's left. And the last thing I want to talk about is our Veteran Center. Really, this is just a collection of veteran resources. Most important aspect there is the networking piece of it, right? We do have a Student Veterans of America chapter for Columbia Southern University. So our Veteran Resource Center allows them to connect to that community. It also connects them to a VSO locator if they're not eligible, or if they don't know where that's at. And then any of the other resources that I've talked about, access to applying for the different chapters of money for their veteran benefits or applying for the scholarships and everything. Really, this is just a collection to take the complexity of all of our websites away and put everything that focuses on the veteran in one place. It connects them to, and it also connects them to their career services. So next slide I had was talking about the learning partnership. I just wanted to kind of cut it there in the interest of time though, and see if anybody, any questions about Columbia Southern at all. And then if you're interested in learning more about our learning partnership, I'm going to stay till the end of the meeting and hang out after if anybody has any questions about that. If I can just add though, Tony, about the city of El Paso is a learning partner with Columbia Southern University. So city employees, that includes the first responders, the police department, and the fire department, they do have access to this, and Columbia Southern is on their inward facing HR website. When a city employee goes to apply for their tuition reimbursement, they are linked into Columbia Southern, they have other learning partners as well, right? So, and that's all.
Do you have your card in this little thing, or?
Say again? I have a stack of my cards. I didn't put one in each one of those, but I'll stay and I'll pass out all my cards here. Absolutely.
Thank you, good job.
Oh, thank you. Thank you. Yeah, absolutely. Thank you. Thank you. Trying to get that skull. Oh, it's not, yeah. First come, first serve.
There you go.
All right, let's go to item F, receive updates from the El Paso County Veteran Service Organization's Director of El Paso League Clinic and other guests in attendance on information on our events of interest to El Paso County.
How you guys doing? My name is Shane Soto. I'm the interim medical center director. I'm here until roughly February, but can be determined up to a year. So I may be here for the full year as well. Looking forward to working in El Paso for the veterans, serving them. I do have a little bit of history here. My grandmother was from here. My sons were raised here for a few years. And then my brother, he was stationed here at Fort Bliss and actually in servant leadership, right, as an NCO. The Soto Fitness Facility is actually named after him. So that was my little brother. So for whatever reason, El Paso seems to be the beacon of where I come back to. And again, look forward to working with you guys. As far as the VA specifically, obviously the biggest thing, 2029, the topping off ceremony, we're looking at first patient seen August 15th. We did have a whole day worth of meetings that reinforced that we are looking forward to that date. Obviously, we're trying to push it to the left. We are ahead of schedule as it relates to the schedule of events to get it open, and also under budget, which is very important in my line of work. Wanted to make sure we stay under that so there'll be no delays or moving to the right. Also, with that being said, you're going to hear a lot about access, choice, and excellence. It's an ACE initiative looking at just trying to create more access for our veterans. Obviously, space, we cannot keep up with the growth. And just as a indicator for you guys, we're at a 13% growth from 24 to 25 is what it looked like as it related to veteran uniques. And we anticipate that continuing for Texas as a whole. Just to kind of give you an idea, 13% may not seem like much, but San Antonio being the second leading is 7%. So just kind of giving an indication between the two cities that like to claim military city. Again, I'm from South Texas, which is the San Antonio VA originally. We kind of compete friendly, but obviously El Paso is leading the way as it relates to growth. In understanding that, we're offering access to extended hour clinics. We're looking at Saturday clinics. We're also looking at sites of care. So we are looking forward to Las Cruces too. There's going to be a second CBOC, not that it's necessarily in El Paso or in Texas. However, it does help our veterans in between with receiving mental health primary care. There will be some specialty services as well to help with that, specifically optometry. Our three main areas for wait times really is general surgery, optometry, and dental, which is expected and is pretty much universal across. With that being said, choice, obviously, we're still relying on our community partners to supplement care where we're not able to provide it. So working those events, making it easier for the veterans to schedule their appointment in the community, making it more transparent, and again, just making it easy and seamless as possible while we continue to work with William Beaumont and offering DoD sharing opportunity as well. Again, it's about continuity of care and making sure the veteran gets taken care of. With that also excellence. So again, we're looking at ways again to just be more efficient, optimal, mindful of resources as we continue to work towards our budget. There's a few meetings on our front that we're going through that was going to help us kind of give some insight to what the staffing will be along with the budget that we can anticipate for that to support it. Vaccinations, obviously flu, COVID, you can get those vaccinations on a walk-in basis. We do have drive-through clinics. We started offering the COVID vaccines as of October. So again, if you're a veteran, pretty much everyone qualifies. There is a list, but they got me on the nomenclature of BMI over 25. I do like eating tacos, so that kind of got me qualified really quick. So pretty easy, pretty straightforward. Transportation, I know that's always a concern for veterans, specifically in rural areas. How do you get to your appointments? We're increasing our footprint with the Veteran Transportation Service. Again, also that allows us to use VetRide and Uber Health Connect. We're more dependent on VetRide. It's more cost efficient. However, we do have Uber Health Connect as well, which does allow veterans to schedule for their appointments that are outpatient. BTS, we just transported our first veteran from Las Cruces to El Paso for a specialty appointment. So we're gaining some headway there as far as increasing our availability. Whole health, the one thing you may get specifically in offices, if a veteran's in priority group 6 through 8, So basically, based off their eligibility, they may receive a copay for whole health services. We did some communication with the veterans that would impact, but just for awareness, there was a bill that was passed. If you're a priority 6 through A, you may be subjected to a copay. Most veterans in that priority group already have a copay, so for them, it's kind of a continuation of business, but that is still not going to make them happy about having to pay that. And really, those are preventative services. So for chiropractor, Tai Chi, those type of classes, again, preventative care is what whole health is contributing to. Same day access, continue on a foot stamp. We have same day access. Why is this important for us? Really, it comes down to the budget. When I say it comes down to the budget, it really is trying to get the money back into the healthcare system. Same day services, just like urgent care clinic. A lot of our veterans go to the urgent care clinic, which is fine. They're entitled to that. They have the ability to do that. But we offer the same service, and it's just getting the word out that we do have those available for our veterans. Because what it does is it allows me to take my care and community budget and recycle it to staff. It recycles it to equipment and supplies that we can utilize to help expand our services that could be available to our veterans internal. We're also looking at an urgent care clinic ourselves. But I do have a philosophy, if you build it, they will come. So that'll just be another way that veterans receive care in between their primary care appointments that may not be considered important. Mental health, obviously, that is our number one priority. Suicide prevention. So anything we can do to help on that front. There is a plethora of pathways, but the easiest way is just call, walk in any facility. We will take care of that. And then lastly, again, just wanted to make sure that you guys have my information, shane.soto@va.gov. They didn't give me fancy business cards yet. I do have this nice little QRC code if you would like to share that information as well, but shane.soto@va.gov. I'm open door policy. Please feel free to send any emails that you have. I know that's opening up, what do you want to say, bee's nest, but I really do operate. I like to get ahead of it and work with the partners to make sure we're taking care of our veterans. So whatever that looks like, that is my priority. Fair enough?
He says we can't go direct. He says he's a gatekeeper. Want to go see you?
I can have a lot of gatekeepers, but there's always a back fence that seems to be open or linked. You got Susie, you got Clarice, I got Connie. Yes, I got a whole team that does that. But with you guys, I will love to be able to handle things at the lowest level. And if there's ways that we can partner just to get education out, I feel like it's just communication. So I think if we can focus 20 minutes on that, it'll save me 3 hours on the back end of something else.
I do have one question for you, sir. Do you have, because I've heard of it, but I want to know how we get involved or how I get involved, the Community Engagement Board. So the BSET. I would love to say that again?
CBET.
I said it backwards. I'm just, not really, but yeah, I think I shot Connie a message back then.
Yeah. You mind if I chime in? I'm your co-chair.
Yes, sir.
So the Community Veterans Engagement Board. Right now there's two co-chairs, right? So right now in fact, I'm looking at Mr. Luther Jones and possibly joining as the co-chair. So both Luther Jones and I will be the co-chairs of the Community Veterans Engagement Board. I've reached out to Connie and we're scheduling a time to meet with Mr. Soto so we can get him up to speed of what we've done in the last couple of years when it comes to the CVEP, our role as a CVEP, the participants of the CVEP, and then once we bring Mr. Soto up to speed of what we've done here in the Borderplex Community Veterans Engagement Board, then we're going to have a 2026 CVEP meeting. But one of the things that we're going to be focused on is getting ready for the next expo, because that's a large participation with the VA, with the city, and the CVEP. So more information is going to be coming up. But that's the update with the CVEP.
Yeah, I heard about it. Like, how we get involved, make sure that he's represented there, either myself or somebody from this board.
Actually, it'll be your seat for you to be the representative in the CVEP.
Any other questions?
Yes, ma'am.
Oh, good.
Oh, excuse me. That's just anyway. Urgent care. What's
Yes.
the timeline?
We're looking at the next 18 months. 18 months.
No, when you come to urgent care?
Oh, when you come there, so we don't have an urgent care clinic
Oh,
yet.
okay.
What I was,
You lost me. I thought you said.
yeah,
I'm like,
no, we're looking
okay.
at bringing an urgent, yeah, we're looking at bringing an urgent care clinic,
Okay.
actual site that's
Yes,
VA. We do have same day, it's the same exact as urgent care.
Question 2. The redundancy of, they text you again,
Mhm.
they text you a third time, a fourth time. Then they'll call you
Yes.
and then they'll ask you, are you coming to your appointment? Then after you go to your appointment, they'll text you, then they'll call you. Did you make your appointment? Did you go to your appointment? So in that genre, there is no place to say, the business canceled me, the doctor canceled me. They're asking the veteran, did you attend? And then we'll get a no-show as the veteran. What can you do to help us with that? With that whole genre of that IT mess. I have no other words for mess. That's.
I can look at it case.
You understand what I'm
I
saying?
can look at a case, and you hear me pause because it's not just in El Paso. We have a multitude of platforms. Our main goal is to make sure we don't have any missed opportunities. Now, is that coming with over communicating and then also leading to errors where I pushed 1, but if I happen to push 2 and then it automatically cancels and you can't recall that message, you get the audio care, press 1 if you want to keep your appointment, press 2,
Right.
and then what happens from there. So there is errors. There is absolutely errors, and I'm not even going to sugarcoat it. If we can solve that, I think you would solve a national type concern that we get. A lot of our V signals, PATSARs, concerns, issues, even through professionals, is essentially to do with appointments and facility cancellations and those types. So we're going to continue to look at it. I know I can continuously hammer home Cerner. That's supposed to be the end all be all with the way we are synchronized with all of our platforms. But we're not looking at that until like 2029, 2030. And the reason why we're so late is because putting it in the current hospital is counterproductive and not necessarily the best use of the taxpayer dollar when we're moving to a new facility. So we will be one of the last sites in the business to get Cerner, which is electronic health record, which also communicates with a lot of the more modern technologies that would be less problematic. You kind of pay for what you get. We usually go with the lowest bidder.
Mm-hmm.
I mean, I'll be transparent.
And then what about the have to copy that you've been to your appointment to bring the paperwork and do your travel or upload it? You have to get a statement now that you've gone to your appointment after they've already harassed you. Did you go? Did you go?
And this is for community care, or is this?
For anything. If you go to any travel assignment, appointment.
It's just like, let's say I go to a chiropractor, right?
Right.
When you go to cut, they give you that little form that said that you mentioned.
Well, some of them don't. You have to ask.
Yeah, so you ask them, and then you or take a picture with your phone.
Right.
And then once you're doing that travel plane, you load it on there.
I know, but I'm saying that's another step. That's, to me, it's like, why are you calling and texting me? And then if I go to the appointment, and then now you tell me to verify, make the people that I went to the appointment for, give me a piece of paper, say, yeah, they came. And now I can get paid for my travel. That's what I'm at.
Let me get more information on that, and I'll send it to the board specifically.
He knows what I'm talking about.
I know what you're talking about as well. I mean, I'm a veteran as well. I use the same services, and in my previous life, I was over BTS. Previous life.
And my last thing,
HAS chief.
a lot of female veterans asking about MST, anything.
Mhm.
There's one that's over here by the fire thing on Raynard, whatever, but it's co-ed. If you're already MST, military sexual trauma, for y'all that don't understand MST lingo, and it's co-ed. If you've already had that experience, you don't want to be in a group with a bunch of men. And so the women are asking in the community, when are they going to start back with another program? They don't have the STAIR program. They don't have any of the programs that used to be there. And so we're trying to ask in the community, when will some of those come back that we can finally go to, that I can put out that they can go to?
I will have to get your information. Then the reason why I'm going to say this, and here's the transparent, I think we're all working in this, right? Space. We need space. And for it to say I only have space that's dedicated for this mission, we want that. That's what we want to work to. There's a lot of funding that's going along with that. But also with that being said, it takes me 10 years to get a new site of care built. It takes me 5 years to open up a lease. The fastest way is usually through a contract. Contract C-Box, you're typically paying 30% more than what you would do if you owned the space. So there is those things that we have to take into consideration. And when I have everything growing at the same rate, it does make it a little more difficult. Now, does this mean that I don't address it? I absolutely address it. I absolutely find ways to make it feasible and, again, veteran-centric. to make sure we provide that care. The ideal world is I would have a women's health clinic specifically dedicated towards that mission and essentially purchasing everything redundant that I would offer in a normal traditional setting just for this specific mission. So I know there's a heavy interest. We're trying to work towards that. A women's health clinic is in the queue, but I'm not going to speak on El Paso as far as where you're at in the queue. We're working towards the same thing in San Antonio. Right now I'm a fire hydrant, so I've been taking all the information I can get and I'm going to pair it from this level. But for El Paso, I want to be able to get you specific answers to your guys' questions. So I don't want to mislead you, but I know there's a lot of interest. There's a lot of special purpose funds, but it also comes with your priorities and what you're trying to open up. And right now I can say foundational services for primary care mental health. There's a lot of interest in making sure I can address those so that I'm able to address our increase in all veteran uniques in service. Yes, ma'am.
I'm done.
So I have a question on, well, first, I don't care who you are, you should get reimbursed travel for massage chairs. All right, but on,
Hey, I never put in trouble about this.
no, you should.
Sorry.
But, on the dental piece, you know, that's a hard hubcap to shine. Is there plans?
So there is a dental clinic in the queue in itself. There is a dental clinic, there's an urgent care clinic, there's a women's health clinic. We just need more dentists, we need more hygienists, and we just need ultimately more space. And currently what we're looking at for Texas, you know, the one thing unique about Texas is property taxes, right? So what's in it for me to move here to Texas if you're 100% service connected? No property taxes. What that also allows you is to have access to optometry and dental. In Texas, if you look at it per capita, we have the most 100% veteran retiree type population, service connected population in this demographics. And it's just unbelievable. Mhm. Absolutely. I mean, but this is a good problem to have, but it is a problem that we have to solve. And we don't have that solved yet with dental, optometry, and a lot of the specialty services. Again, if I'm trying to do continuity of care and I'm trying to quarterback it, all my resources are going towards mental health and primary care. And then from there, try to build specialties that we know we can do well. Also include William Beaumont, because I think we have a unique partnership with them as well, because it keeps their providers credentialed in a sense of, are they wartime ready? We give them the complexity of cases that they will need. So if they ever get called to downrange, they're proficient in their skill set. So it's a balance of that. Do I pay it for 3 times or do I pay for it twice, or can I do it just by myself? And then if I do choose to take on that, am I pulling the ability or am I pulling war readiness type training away from the providers at William Beaumont? So there's a lot that goes into that. It's unique. I'm still learning more. So as I learn more, we'll figure that out. But I know dental specifically, one of those ones we want to do well because it's very expensive in the community. It's very expensive and it seems to always continue to go there for cleaning, and all of a sudden they say 2 fillings fell out, but you didn't feel them fall out until, you know, they show you on the screen. You're like, no, you just knocked them out. I felt that when you loosened up things like RFSs. So
I spent 4 hours in a dentistry yesterday. They loved every minute of it.
yeah,
They're planning Christmas over me.
I bet you they were a couple crowns and yep.
That part.
Those one things for me. He's a true ambassador for the VA. Absolutely. He's on the front line every day. He's I can't read what you wrote, but you know, he's kicking butt every day. And he's a pleasure to work with.
He didn't come out last Wednesday and help me, so to get him with that food job, he came out after we finished.
I was there though. I
You
tried
were
to
there.
supplement.
He
I
wasn't there.
tried,
He
but
came
we're
last.
battle buddies. I supplement him.
I was doing, you know, I was doing.
What?
No, I was doing a special mission. I was doing the tactical something we're doing. That's what I was doing.
That sounds like a good senior in COE.
Go right. Remember, you know what? Sorry, you got the queue, right?
Yeah, right in the queue.
I was doing tactical operations.
Yeah,
That's what I was doing.
popcorn, right?
We go beautification.
We do have a beautification. So if you guys ever, on a Wednesday morning, first Friday of the month, if you ever want to intermix with the leadership team there at the VA, we're doing beautification. Instead of paying for the landscaping of the facility, we're just going around and pulling weeds. And I can say you guys have some disrespectful stickers. Those things go through leather and everything.
Yes.
My fingers were, I went to go type afterwards and I was like, I think I still got some in my fingertips. But nonetheless.
Thank you.
No, he's good people.
absolutely.
He's good people. He comes in.
But do the travel vouchers, though. For the ones that don't like to do them, it actually helps the VA when you do them. It actually
does.
Some of that money goes into something else that helps veterans. So when you do that, just because it's $2 they're going to give you, please fill it out. I know Mr. Boyd. If you guys don't know Mr. Boyd's on the 3rd floor, and you look like you need some retraining, for Mr. Boyd
Why?
on everything to do with travel, because you complaining about it. So we're gonna get you retrained. I'm gonna tell Mr. Boyd you coming down 325
That help is really user.
Yeah, that's what
I just found out you had that.
Guys, I wasn't gonna make it personal. If you're still doing paper, that was out there product about 2 years ago. Don't be too happy. I wasn't gonna throw it out there. I'm not. I'm just trying to advance. If you can get on TikTok, Instagram, Facebook, we can do BT Triple X.
You can read them though.
Yeah.
Don't read the memes.
The VA.gov app is super user friendly. It's like,
It is.
how many appointments did you have? Did you go? You want to travel voucher? And then 2 days later, like the money's in the account.
And if you know any veterans that have issues with that, just send them down to the 3rd floor. Our volunteers will teach you how to use it. Our, HAS team there with Mr. Boyd and transportation can help you use it. We teach classes all day long, right there.
Is it just for travel vouchers or all things app?
All things app in that app, because everything combined in February. You guys remember I came and gave you that? So everything combined. So now it's everything one-stop shop, like we say in the military. Okay, so you can do everything from your letters to everything is in there.
Does anyone not have I was the last one to get it, I think.
Yeah.
Yeah, I think you told me, I never had that. It's amazing.
The amazing thing is like when I hear veterans complain about prescription refills, or like they literally have one button that says refill everything that's available, and you push it, and then your meds come. Like, I just once a month I log in and go refill everything.
And you know the cool thing about that? Let me tell you another cool thing about that. The director sits there every morning with the team, and they go, how many messages we missed, how many messages we gotta get back, and he said, hey, by the end of the day, we will respond to all these messages. So don't think like nobody's listening to you, or those doctors and nurse practitioners are not paying attention. They are paying attention, and sometimes it's so busy, but they catch up and they make sure that by the end of the next day, we don't have work that hasn't been done. So, keep doing that, because that helps us to get better.
Oh, one alibi,
Yes, ma'am.
the formulary.
Okay.
Can we not make it a dinosaur? Bring it to the extension.
Can't change it.
You don't like vitamin M? I mean, that's what we got for everything, right? Was vitamin M.
You didn't know?
Motrin, yes.
The Motrin later.
And now vitamin M is now vitamin T.
Yeah.
It ain't Motrin, it's Tylenol. So yeah, I just need something more.
I know there are always, I mean,
I need them up to
honestly,
speed with what's out
there is a pathway, right? Working with your PCP, if it's something specific to the brand that you need, obviously there's a way to do that. But also I hate to say this, veteran care should not be driven off cost, but at the end of the day, we're still trying to do the most for the most based off of our budget. So there's a reason why there's a standard, formulary. However, if it's unique, obviously there's a process for that. So work through your PCP, they can review it.
I did, but I'm just saying.
Yeah.
It worked out, but it took 3 months.
And some of the things too is education on the community partner side, right? Sometimes they're able to provide certain prescriptions or they recommend, and they are not familiar with what we do, even have to even consider it. So sometimes that creates a little bit of frustration on the veteran side. So they'll bring in their slip of this, and they're like, we can't do that, but we can do this. And it's like, I don't know. I feel like you're giving me Fruit Loops, but they're fruit holes, and I just don't know if it's the same thing. But but I do understand. Correct. Yes, ma'am.
Thank you.
Absolutely.
Thank you. Yeah, for joining
Thank
us.
you. I appreciate you guys.
Good to meet you.
Absolutely.
Okay, with this period officer with all these questions.
No, you guys are kind. You guys are kind.
I've seen some service organizations that go kind of ham on the VA. Try to say everything in an intelligent way so that we can address problems, not just yell about them.
You're the number one VA, and it shows every day.
It does.
That's one thing that I know this team is really anchored to. I mean,
And you just
it's a flagship.
box to be out where we can see it at the VA.
They hit it specifically from you.
I need to put some more stuff.
I know it's
No,
gonna be
these
in
are
my favorite
compliments.
fight.
These
Yeah.
are compliments. No, I mean, yeah, and then they direct you to behind some pole. Where's it back here?
Well, the other thing too is the town halls. They seem to be very beneficial here.
When you get in queue, they
you're
don't get
able-
you. He already knows. He already heard my.
Well, you got Shane.Soto at VA.gov specifically for you, ma'am, and I think you're gonna be in my top 5, so I look forward to it. It'll be like MySpace top 5. I'll have a song and everything.
And you can blackball me. I'm not gonna be able to get to you.
Junk emails.
He needs a re-education. You need to re-educate. Look, there's like thank you boxes everywhere in the VA. You look right and left, there's like, you can write a little comment and put it in the box. There's a little star note on it.
It's all online too, though.
Yeah, it's online too. You got it. You got it.
93 calls, hey.
Yeah.
I already
I mean,
put it
it's
in.
one of those times where you
The
just
one or two
acknowledge
times I
it
got
without a
into-
solution.
I did get my compliment.
So first, I spent the first year just nodding her head.
Hey, thanks for coming. Thank you
I
very much.
appreciate you guys.
You got nothing to say? Ben, you ain't saying nothing?
You guys.
No, I mean, you cover everything.
No, you didn't, no, there's something. Wednesday.
But I got done, I'm not gonna distract you.
Okay, Endeavors, we're coming over for treatment.
Yeah, thanks.
So if you need.
We're open soon, sir.
I need to write it for you. You got it? I'll talk to you. Yes, sir. So.
Thank you.
Thank you guys.
Thank you.
Okay, yeah, I know you are.
Which one?
The supervisor Gina received an update from the city of Paso coordinator regarding veteran issues. Joe?
Hello, so just quickly here, the VAC, the Veteran Advisory Committee will be Thursday at 10 a.m. Usually you guys come and support, so I appreciate that. That's still as scheduled, so keep moving on with that. Same time as Veterans at Breakfast,
Right after.
sort of, yeah, so.
8:30 to 10.
Right, yeah, so perfect, yes, if you can roll from there. I'll bring some, I'm gonna have somebody, I gotta find out who is gonna bring my flyers to that, so I can pass out some information there. But more importantly than that, that always happens, but we did get a date for the expo. The expo is gonna be the 20th. I think you heard Ben talk about that. I'm gonna be getting with Ben and the VA. We're all gonna kind of come together, and then I've already spoken with Tony from the county. I want the county to be more actively involved in this. Ben and them haven't said yes yet, but the summit, I'm looking to use that nice Endeavors place for the summit. It's got all that technology and all that parking that he keeps talking about. So, so the 20th, February 20th, that'll be the day of the expo. I think it's a Friday. I'm pretty sure it's a Friday. It'll be
It's a long weekend. Right after a long weekend, yeah. President's Day. Not that I.
Yeah.
Usually we do this 2 days, but we cut it down to 1 day. I think it can still be effective and get what we need to get across in 1 day. Outside of that, something council approved this morning, they approved the funding plan. So our department, we would take in donations and any kind of funds or gifts or anything like that. And it was kind of a convoluted process to get everything through the comptroller and all of that. So the Paso del Norte Community Fund, the city manager is going to reach out to them, and we're going to try to use a fund from them. And then the good part about this, it streamlines it, makes it much easier for people to donate. And then also people who donate, like say Marathon Petroleum, GECU, or Columbia Southern University wants to donate to one of these events, then now they can get the tax exemption. They can go through that process. It's a little bit more difficult with the city. Our next Coffee with Veterans is going to be the 9th of December. I know usually we do those on a Thursday, but we're doing them on a Tuesday until we kind of get the schedule going the way we want to. It's going to be at the Star Veteran Program at 1390 Northwestern Drive. It's 8:30 to 10. There'll be a flyer. This information will be put out. I just want to let everyone know it's going to be December the 9th. I think that's a Tuesday.
What?
Star Veteran Program. It's at the Rio Vista Behavioral. So the idea behind this one, we try to always theme these. This one is going to be kind of mental health focused to beat that holiday blues. It's around that time. So we're going to do that. And then January, the first of the year, new things. We're going to be at Endeavors, the new Endeavors location, that wellness center, to kind of kick that off to do. I know they already did a tour, but we'll do the more in depth for our situation.
Oh, it's at 9?
8:30 to 10:30. Yes, sir. And outside of that, business as usual. There's some things happening behind the scenes with the VAC, but business as usual. And then we are there to support the county. I know the county, we have some initiatives and some things going on. The city's there to support 100%. So that's all I got, unless you guys got any kind of questions or.
questions for Lisa?
Good to see you. Haven't seen you in a long time.
I need a clone.
If you just take your hat off, no one will recognize you.
That's what I do on the weekend. I walk past you guys all the time on the weekend. You don't see
I
me.
think probably, I'm like, Lisa's got a top of his head.
I know, right?
All right, let's go to item H, receive it over from the Paso County Veteran Assistance Office.
Okay, so I'm gonna share a couple of things. My battle buddy, Melissa Hardcrow, asked me to share. And if you want these are female veteran specific events. If you want these, I already have an email teed up so I can send it to you, but there's a Connect with Us, Texas Veterans Registry. And there's a QR code to register. And then also she has this, I'm trying to pull this one, the Coping with Transition for women veterans. And her things are women veteran focused, but they are not specific to women veterans. But she'd asked that I share both flyers with you. I can forward this information to you so you can share. Huh?
We don't go to this.
You can. Like male veterans are more like, she did a women veteran focused claims class that I taught, but there were male veterans in the class because male veterans also have women veteran battle buddies that they're trying to coach through claims or whatever, for whatever reason. You might have a sister, cousin, somebody that's trying to help, whatever the reason, but she doesn't, she doesn't segregate in that fashion. So she wanted me to share those. Also, for those who don't know, we have 2 unaccompanied burials this Friday, Friday the 21st. There's one at 0930 on the east shelter and then at 1100 hours on the west shelter. We are getting ready to go into the holiday season. We have a few that we've confirmed are veterans, but we haven't actually buried yet, and Purchase does that. But I've asked Purchase to consider, like when we're not at work, not to schedule it so that our crew can also enjoy the holidays, so specifically like the day after Thanksgiving.
What were the times again? I'm so sorry.
9:30 and 1100 on Friday.
Thanks.
And I can send you both flyers with her.
You send me some flyers.
I sent them out with the calendar invite. They're both
I
on
got
the calendar invite. Yeah. If you open the calendar invite, you should be able to see them. So they stack 2 on Friday, and unfortunately, I have a doctor's appointment, so my team will be handling it. If you can support it, so we really greatly appreciate that.
I'll be at 9:30. I can't go.
I'm there, bro.
I participated in Vets Giving this Saturday with Military Veteran Career Network. You know, Commissioner Butler had done a resolution to partner with them on that. My office, myself and Mike was tabling, giving veterans information about what we do for veterans. And I was out there kind of conducting traffic, trying not to get run over. I do have about 9 baskets minus the protein. Like there's no meat in this basket, but it's got your standard staples for Thanksgiving. If you know anybody that's in need, let me know. I will get a basket to you. Other than that, I'm going to go looking for people that we can feed because food shortage is a need right now. I want to make sure that people are taken care of. Wreaths Across America is 13 December. We'll have another meeting before that, but for those people who volunteer to lay the wreaths, I normally go out myself and do a couple of hours of community service just to support that function. If you're interested, I can send you the flyers, but it is the 13th of December. Normally starts around 07. There's a ceremony around 10. And then they also do a cleanup, which typically there's less people there to clean up than there are to the wreaths at the graves before the sun. Any questions from the board? Next item,
All right, let's go to item I. Discuss and take appropriate action regarding Veteran Advisory Board short and long-term goals for 2025.
Okay, so I think we've met our goals, but here's where I have, and I've already looked into it. We did ask that our communications team launch a resource guide, right? Mm-hmm. And somebody from their team was working on it, and then they went on FMLA, and I never heard anything back. And so I've done an RFI to that section and included my supervisor for that, just so she knows what's going on. But I haven't gotten an answer on it yet. Just more standby for more information, but I want that linked also to the Veterans Capital of the USA, so that veterans can see it from multiple links. And then the county is also redoing their webpage, which I think is part of that too. But Commissioner Stout specifically was asking about that resource guide, and we had reported back that it was going to go live. So my plan is to do a highlight to the court and include where it's at, because we're supposed to go live right before Veterans Day, as in partnership with Veterans Day. And unfortunately, I don't think that I did follow up on it. I haven't heard back, but I plan to stay on it until we answers. The last thing we're going to have to do is maybe do a wrap-up session. Maybe next meeting we'll just wrap up our goals for the year, kind of do because at some point in the new year, we're going to have to go to Commissioner's Court and say, these are our new goals, and this is what happened last year with the old goals. I think we've done very well as far as keeping it on track. So that's what I've got on the long-term and short-term goals. Is there anything from the court on that?
Did you want to on that thing? Just that.
Do we have any short-term goals that we want, anything we want to look at doing? I know we're busy with the holidays. I know every stop sign's got a turkey drive, so. Anything else the board wants to look at
For next year?
for going into next year, or once we get to next year?
I can tell you things I want to look at next year. I want to look heavily at, one, legislation. Two, I talked to Luther about this, about having a unified voice when we go to city council or county commissioners. It's one thing for me to go, hey, I need you to support House Resolution 4469 of Zuma. It's another thing for me to say that and have 100 veterans standing behind me saying we agree with this. We need to unify the community behind our legislative agendas, and we need to be smart about it. And I think the county and the city, the BAB and the BAC are poised better to do that.
Yeah.
So what I may do is start doing a legislative update with the BAB starting January, so you guys know, and we can research it. You can go home and individually look, or I run a lot of stuff and I'll be like, how does this affect veterans? Is it something we're pro, something that we know? Last year was legislation on firearms, and even though this is Texas, El Paso isn't necessarily pro firearms as much as the rest of Texas. So like there are things to consider when we're talking about the interest of El Paso County. But that's one of the things that I would like to look at in the new year and have a unified voice, people that we say, hey, we want to support this. And then we come to the city or the county effectively together.
There were over 100 people today for Eddie Guerrero Day. So if we did that same thing in the veterans space, we'd get what we want.
Yeah.
Like standing room only.
No one in politics wants to say no to a veteran. Like, and it's one thing for you to be an employee and say, we need this. It's another thing if I have BAB 187 standing behind me and the VFW and the American Legion, because we're all connected to each other.
You all
So,
vote too. That means
and you do have like
78% veterans vote compared to 7%.
So, also I'd like to look at the thing Mr. Barcelona pitched is like honoring, making sure our commissioners, understand like what we have here, making sure why. There's some other projects I'm working on that will be with the Veteran of the Year, and we'll announce that once we have that. We're still working out some stuff for that, and then the alumni as well. So that'll come once we figure out where we're going with what we're doing.
Anything with the Veterans Capital of US?
Not yet, but there's some stuff in the works for that as well. So yeah. That's all that I have as far as.
Speaking of it real quickly, because one of the reports that they made was signs that are coming in from El Paso. Is that still?
So that was started last year in Erica in the judge's office, and I'm not sure. I have a meeting with communications next week, specifically to talk about where they left off, but I'm not sure where it left off. For full transparency, I have requested, I don't know if it's going to happen, but I have requested that my office specifically may take control of the BC USA stuff. I don't know if it's going to be better or not for what we do, but like I think we are embedded knee deep to be able to function that. So that's something that I wanted. That's one of my goals for 2026 is to assume that so that we can push our agenda, we can push it forward because the veterans believe in it, veterans want it. And you can't give veterans something and then take it back. It's just that's not how we operate. No. Don't give them something, a title, whatever, and take it back. So.
Hey, Tony, I know DeBoe had brought this up about you guys as alumni. So just to make you guys aware, and that Thursday, they're going to bring this up on the agenda for the back. Donna Juarez, a previous veteran of the year, she was, and she's going to bring it up to them for a discussion, that I guess it would sort of be this sort of alumni for, I guess she wants, I don't know how this is going to fly, but the city to do sort of their veteran of the year, but it's going to be veterans of the year that can't be active in the community, like that are older or that may have already, they don't want
like the honorary.
Yeah, well, honorary one. Yeah. They give honorary one where.
105-year-old guy. 101.
Okay, no, I was just trying to see if they could combine that some kind of way.
Well, we had planned to honor like World War II veterans going forward. That's something that we're planning to do. And I think that when we talk about the city county combining,
there you go.
I think that's something that we should look at too. I think that everything we do should be on a unified front. Mm-hmm. I am with that. I don't know how we sell that. I know that the county and the city like to have their own things and their own
territorial.
But not when it comes to veterans. We got to be on.
I'm the only military veteran person, so the silo's over. There's no other person at the city that's like, no, we're gonna do this.
The mayor
They'll agree.
to agree as well, but
Especially if it doesn't cost nothing, if it's just, yeah.
I guess, yeah, it's a, maybe we recognize the veteran year both at the county and the city. Maybe I don't know. We would have to, there is a policy that governs how we pick the veteran of the year. So if we were going to include the city in that, we would have to look at rewriting that policy. So just food for thought, but that's something that you and I can discuss, so we can go forward with that.
Thank you.
You just grow for more than 1/3 of the year.
No, I wouldn't want, I wouldn't want Donna to just, recreate something. If you guys already have something in play, I think it would be better to just, you guys already have this thing working out pretty smoothly here. We should sort of, like, I think what Tony said, we should just kind of complement it, kind of support it, and then it could be under one umbrella instead of this like city different one.
The other thing that we could look at is the option of having a joint committee meeting the city and county.
I think that would be amazing.
That's legally, that's probably it's possible to do that.
Like combine both meetings?
Right.
That'd be amazing.
One less thing to do.
Well, they holding the meeting at the same time.
Yeah.
Together. So you're two entities, but it's a joint meeting. That happens on occasion.
So would we have to make two separate quorums? So like the county would have to make quorum and the city would have to make quorum.
And we have an issue with that.
Really?
I'm like praying every time. Show up.
I can join the back.
There you go.
Then we'll all be formed out.
There you go.
I don't have a corner. I'm just over here by myself.
We do have vacancies in
I'm in the Northeast.
District 4.
District 4 and District 7.
No. Really?
No, Nintendo.
I'm being nice today.
I know.
Okay, that's all that we have on that item. We can go next.
Item J, just
Is it pay the same there as it is here?
You get empanadas here. Yeah, you get empanadas here.
Empanadas.
Okay, so we gotta order those empanadas.
That's right.
Sorry. Item J, discuss and take appropriate action on future opportunities for the Veteran Advisory Board.
So one thing we need to discuss, and I know that we want to meet in December. So two things. One, do we want to do some type of holiday gathering? Two, do you want to meet in December? We may want to meet, but quorum may be hard to meet.
If people are out of town.
So that's the thing I want to make sure is that, like, if you say you want to meet the 9th. Yes. The next meeting would be in like 2 weeks on the 9th.
You want to do it here? Do you want to do it offsite?
Well, we can't do it offsite if it's an official meeting because we have to record it and publish it. It's got to be live, all that.
You get to go.
There's internet, we can do it.
So, but we can meet, we can shorten the meeting, and then go maybe have lunch, or we can, whatever you guys want to do. It's just something I wanted to discuss. My office is very small. There's 4 of us, so sometimes our Christmas parties are a little, well, like Luther's by himself, so he's like, hey, Merry Christmas. So we can all get together and
Come join us.
and that's what I mean. Like, we can all get the
Do we want to cancel the meeting in December and do an off-site function?
What's the prerequisite about meetings? Do it.
I just
Every month?
no.
No, I talked to the
Yeah,
board.
yeah, I mean, so, right, ideally we want to have quorum, but if you're together socially at the same time, as long as you're not discussing
Business.
agendas or making any,
There's nothing that says that if we cancel it,
that you can't,
we can
can't have
cancel.
lunch.
Yeah, I know, we can cancel it. There's nothing that,
Oh,
there's no requirements.
to
Yeah.
have a meeting.
Like, if we knew we were gonna have quorum, like say you were gonna come today, I would just notify the normal attendees that we don't have quorum. We would probably come here and send anybody else away saying like, thank you for coming. We can come.
We can sure do information. You're a master of that.
Yeah, so yeah. I don't want to get myself in trouble here, but we've held meetings, but it's just an informational meeting. There's no
Without a
voting.
quorum, that's right, no official action.
Yeah, you do the guest speakers and just know.
It's calling us out, huh?
Well,
Calling
if
us
you're
out. I'm praying for quorum on Thursday.
Make a motion to cancel our December. Y'all listening?
Yes, we are listening.
I can hear you. Huh?
Go here and listen.
Unroll your eyes.
I make a motion that we cancel the December meeting and have a social
Or
gathering.
we just cancel.
Yeah, we
I
don't.
want to make an agenda, have a social gathering. Just-
Okay, cancel the meeting.
All in favor?
Anyone else?
So now the meeting's canceled.
Officially.
Have a social
I
gathering.
think we wrote it
With a
into
white
the
outfit.
fact that there's no meeting in December.
Would it fit into
If I'm available, I'm there. Let me know.
What
We'll look
day?
at dates.
Still the day, same day? Do you want to go the same day since it's smart day?
Yeah, we'll talk about it after. After that, yeah. Man, you just got corrected so hard.
Don't do it, Mike. Don't do it.
Let's go to item K.
Yes.
This is monthly update from the Veteran Advisory Board. Members on any items of interest or issues from the representatives for Cleveland veterans. Start with the Cleveland one. Mark?
I know, she brought it over with Shamir, and well, she's done now, so I got to go over and see. I'll stop. And he's excited about it. We know a lot of veterans in our precinct, especially with, Thanksgiving stuff and all the amenities and all that, so. Nothing new on precinct.
Precinct 2 absent. Let's go to Precinct 3, Mr. Diego.
I have nothing.
Precinct 4.
Precinct 4, I met with, actually a couple of people. We're doing this, mural for Carl Robinson, passed away last year, December. The whole premise of it is to do a mural and keep his memory for everything that he did for the city and the county and just El Paso, Texas, period. Met with Commissioner Coronado, also with Councilwoman Trejo, and the artist, and Arts of El Paso, and Parks and Recreation. The site is going to be Veterans Park in the Northeast. It's a 100% go project now. The next meeting, I'll bring you the actual mural, a little miniature one of it. We also have the garden part of it. We're gonna have garden boxes. I have pictures of that. I'll have them printed out and passed out for the next one. The garden boxes are gonna be in the actual space that's at the recreational center at the Veterans Park. It's adjacent to the swimming pool. The swimming pool is closed until summer of next year because it's got issues going on. But the building is there, the black caged gate area around it. You see the blue canopies, and Parks and Recreation has already leveled out the sand and dirt. They've already pre-built about 6 of my boxes for the garden. We're gonna have master gardeners that are gonna help us with soil content for El Paso weather and dirt. And to be able to grow what we want to grow. We want to have seniors targeted and juniors, meaning kids, so that we can have gardens that are appropriate for their ages. Like little kids, we want them to see something grow, that they put a seed and they grow it, and then they can also harvest it and take it home and cook healthier meals and not have to pay for cucumbers, lettuce, tomato, etc. Seniors, if they want flowers or garden stuff, the same. Double stacks for seniors that for bending over and not hurting themselves. Double stack for the kids that are short and are able to stand and be able to do theirs. What am I leaving out? Luther has a question. Go ahead.
So, I know the area. How's the ease of access going to be?
Ease of access is going to be through the rec center because it's going to be locked for security purposes and nobody can go in and disrupt or tear down or destroy anything that's being done on the inside.
And then
the entrance, when you walk in, you have to come all the way in. As soon as you come in, if you actually make that immediate right, you'll follow that railing, that black wrought iron thing that's all the way around.
Got you.
It's locked all the way around. To get access is when we stand, we're doing something there, and the people that run it will actually unlock it, and we can go out and do what we need to do. Parks and Recreation has an access to the backside of the fencing, but it's closed-in fencing, that mesh netting, and that keeps the people from being able to destroy anything or climb over it, what have you. The awnings are going to stay up for the protection from the extreme heat and sun, but we'll still be able to water and do everything. There's access to water. There's a water fountain there that they're going to have access to be able to water the garden boxes, and also if there's anything else that needs to be washed down and cleaned up.
And then will you be able to see the mural like from?
The mural is going to be above the garden box.
So you'd be able to like say you come and look through those little.
Yeah, you can look through and see it. It's
Okay.
a 50 by 20 space with one like a light that's there and a window off to the side like a classroom or something, but the actual wall that we're using is a 50 by 20.
Okay, excellent. Thank you.
I have pictures, I have whatever. I'll get those printed out and have those ready for January.
And if you, sorry, when was when were you guys planning on opening?
Okay, for the art piece, because of how much it entails, like gonna be a $50,000 project. And, oh yeah, they're trying to minimize because the art people now have, you know how you wrap your cars? Okay, well, they have some new art thing that you can actually put the mural up a different way. And if you want to move it like 20 years from now or 5 years from now, you can peel it off.
Because vinyl.
Roll it up and go move it and put it on another wall.
What are those stickers called?
Vinyl.
No, but I'm saying, but it's not vinyl. This is actually going to be a type of, it's going to be a type of paint that's enmeshed in something. And that's how you take it off and put it on. But they're trying to get the cost down based on the new modern acrylics and paint stuff. So my artist is, if you don't know,
$50,000.
well, that's okay. It's going to probably be less than that, but that's what we started at because of all the amount of equipment that was needed and stuff. But James O'Rourke is my artist, and some of you probably seen him. He's done the cathedrals, Irish, Julie thingy. I'll show you that one, so I'll print it out. He's Irish, that's why I gave it to him. But he did their mascot thing on their wall. So he's done several things in the city. I was blessed to get him and a few others to compete. And I picked him because I know what I want, and it's my project. That's who I am. And what else? Any other questions?
No, thank you, I appreciate it.
So the art is going to take probably another year and a half. So it's probably going to be 2027 because they just painted the wall 2 years ago. So there's a lot that goes into this art stuff. No, there's a lot that goes into the wall, meaning that it's been painted, but now you have to reprocess the whole background and then put up whatever this El Paso art guy and my guy, the artist, they have to work together and get this thing done inside of an art studio first, and then be able to bring it in and then put it up.
Okay.
And that's going to take a little time. Plus the funding, some of the funding has been granted by Commissioner Coronado's office for the arts that they have for the city of El Paso. And the garden boxes are beautiful. They look like cherry wood. And if you don't act right, you will be fertilizer because I can put you in there. That's how long it is. We can bury a couple of bodies. Just letting you know. So,
Thank you.
You're welcome.
Is that everything for precinct 5?
I mean, they look like carrots.
I think that's it for me, yeah.
Okay, good.
Judge Appointee?
Nothing to report.
Nothing?
No.
All right.
Can't follow that, can you?
Really? That's
Do I
what
hear a motion to adjourn?
I move to adjourn.
All in favor?
Aye.
Anyone opposed? Motion carried.
See you next year.
Can you press?
No, December.
December 9th.
Muscle memory.